Hi, my name is Kiran and I'm here with Kathleen Smith, and we are doing a presentation that is sponsored by our Association of Psychologists in Nova Scotia, APNS, in preparation for February 2021, which is Psychology Month. We've chosen to present on COVID-19 in 2021, the pandemic echo, and what this means for our children and families. Kathleen and I have had the privilege as clinical psychologists to hear the stories from a lot of children and families over the past 8 months that reflect on their experiences during the pandemic and how it's impacted their life at home, their social life, and their mental health. I'm going to start by presenting for the first few minutes and provide some information that we've gathered directly from our clients. And then Kathleen is going to start the second half of the presentation by presenting what we can do during the pandemic echo to ensure that the impact of the pandemic is minimal for all of our children and families. I'd like to start by just defining the pandemic. So, pandemic comes from the word pan, which means total, and it's a prefix for demic, which comes from the Greek word demos, which means rare or pertaining to people of a district. And in this instance, district means world. So a pandemic is defined as a global spread of a rare new disease. And a pandemic is different than an epidemic, which is simply an increase in number of cases of a disease above what you would normally expect in a population. So for example, measles or an outbreak of measles, let's say in HRM, would be considered to be an epidemic. So a pandemic clearly, like we all are experiencing, is much more global and much more impactful. And the last time we've had a pandemic was in 1917, and that was the Spanish flu. And it was the last time that we are all aware of where you're impacted by an illness, a disease of this magnitude that affected so many people across the world in so many ways, including a large number of deaths. And so, given that the pandemic isn't typical, that it is so vast in the impact that it has, there are many, many reasons related to it. So that indicate why we're anxious. So what we know of COVID-19 is that on January 30th, 2020, WHO, the Director General of the World Health Organization, declared an outbreak of COVID-19, and it became what was called a public health emergency of international concern. And at that time, during January, February, we were just learning a lot about COVID-19 and the illness, and people were still, lots of questions, still traveling. A lot of people thought it was, much like the flu because that's what the media was telling us. And then, all of a sudden it seemed in March 22nd to be specific, our province, the government of Nova Scotia, declared this provincial state of emergency. And suddenly it became very clear to us that COVID-19 was big and it was affecting many, many people. And so we started at that point our provincial shutdown. And here's what we know. In the following few minutes, I'll talk about what we know happened subsequent to March 22nd, related specifically to COVID-19. So the March to June Nova Scotia shutdown contributed to a lot of different things. And, this is just a very short list of things that we have discovered from our conversations with the children and teens and families we talk to. So some examples are there's a clear increase in feelings of lack of control that people were feeling. So a lot of anxiety based on not knowing what was happening. And this either came to some people in, what we call waves. So little waves of anxiety, medium waves of anxiety, or like tsunamis, like huge feelings of not knowing what was happening. And for some people, it was a constant feeling of anxiety over the past few months. And And it could be low grade anxiety or higher grade of anxiety, depending on a variety of circumstances in people's lives. There's also hypervigilance, and people were, reporting to be in a constant state of alertness. That is always being aware of what was happening around them and always having to be, so to speak, on your toes and wondering, what's happening, what's coming next. And part of this was coming from simply, what we were hearing on the news, how quickly things were changing, just in things in our lives that were happening on a day-to-day basis that made us just, be that much more aware of looking around and trying to figure out what was happening. And as a result of some of those things we were hearing in the media, we all had to adapt. And, it seemed like we were constantly adapting in the early stages of the pandemic because we were getting lots of new information all of the time. So, we had to keep our distance, we had to wear a mask. Some parts of the country, people actually weren't sure whether they had to wear a mask. In Nova Scotia, we were told fairly early on that it was helpful. Some people had to, work from home. Some people lost their jobs. Kids didn't go to school. So lots and lots of changes that we had to adjust to and adapt to. Related to that, also just a lot of changes in our routines and finding new ways to do things. And, in many ways, as hard as that was, I know for me, one of the things that, was really interesting is that, we learned how to have new routines relatively easily. And I think that in many ways that's positive, that we found ourselves adapting and finding new ways to do things. And maybe that's, a message in some ways for the future of when we think we can't do something. It might be a little bit of a message of, maybe we can. Definitely not in another pandemic. Hopefully this doesn't happen again. But just in our everyday life, having to change routines so quickly, so often, also might have shown us a little bit of, that we can actually do that. Time away from family and friends, this was a common thing that happened. Worrying about getting ill or dying. A lot of people definitely had lots of concerns around that. A lot of feelings of isolation, loneliness. And one of the biggest things that I believe continues is fatigue. So physical fatigue and psychological fatigue. Just a lot of different factors contributing to that. That lots of kids, children, and children, adolescents, and parents reported. So in a pandemic, it was interesting to think about what does our brain do? And essentially, it's all of the stuff related to how we adapt and how we adjust basically to the messaging we're hearing and sustaining it when we don't know when it's going to end. So our brain in that context simply just gets tired. And again, especially when we can't see a finish line, right? So there's no start and end date. There's just, here's what's happening. And we have to adapt and adjust to keep ourselves safe and keep our community safe. And it can be fairly exhausting. So I'd like to talk a little bit about just what happens in our brain that can cause fatigue. So we have in our brain, as a part of our sympathetic nervous system, what's called the amygdala. And the amygdala is like an alarm that goes off in our brain when there is danger. And it's a very adaptive instinct, survival instinct to have. And it creates almost a natural response to danger. So an example I often use is if I were crossing the road and suddenly I saw a car coming in my direction super quickly, I would automatically, without thinking, run to the sidewalk or somewhere, basically to get out of the car's way. So in that case, my alarm going off, the amygdala firing, is really an adaptive, protective mechanism. And so it is triggered usually by a large number and variety of emotions, such as fear, anxiety, aggression, anger. And again, it lets you, sorry, that's my phone. Sorry about that. So it lets you basically do what you need to do to get out of danger's way. And many of you might have heard of the fight or flight response. And so that's that mechanism that happens when the sympathetic nervous system goes off, or the amygdala goes off. And so what happens in the face of real danger is really adaptive. But then our alarm system, often, if any of you worry or have anxiety, you know that often the alarm system, the amygdala, will go off even in the absence of real danger. And then it just, it creates a constant state of anxiety. So what's interesting in the face of a pandemic is there is actual real danger. And so we have all these messages around, keeping our mask on, keeping distance, all of that stuff, keeping our community safe. And we're always being told to do a good job, even when we're trying to do a good job. And so that messaging really creates, a lot of anxiety in a real dangerous situation. However, if we are keeping safe by keeping our distance, keeping our mask on, doing what we need to do, our alarm system probably doesn't need to sort of be as attenuated as it can be. But then there is that almost dilemma of, can I relax? Can I not relax? So, or, how am I supposed to feel? And so the frontal lobe is a part of your brain, which I call the boss of your brain. I think lots of people call it the boss of your brain, and it's almost like the CEO of your brain. And it is the part of your brain that helps you problem solve, helps you figure out the right thing to do, basically helps you come to conclusions regarding your behavior. And what happens during a time like this is it's trying to basically help you problem solve, how worried you should be. But when the amygdala is firing, it's almost like the CEO of your brain is held hostage by the amygdala. And so there's this internal battle of anxiety versus logic. And because you can't problem solve, or you're having to problem solve all of the time, because your brain is, firing and making you anxious and thinking about the pandemic and all of the stuff that goes with it, that is fairly exhausting, because you're always trying to think, you're always trying to problem solve, you're always trying to figure out what to do. So for those of you who feel fatigued by the last 8 months, 9 months, there is a real reason why you are feeling fatigued, right? So it's got nothing to do with your own like personal strength or capacity or anything like that. It really just has to do with the fact that all of us are trying to navigate our everyday world in the best way we can when we are in a state of alertness, a state of just feeling anxious, trying to adapt. And it takes a lot of effort for a variety of reasons. So I hope that makes sense to everyone, to explain maybe why they are feeling the way they are with respect to fatigue. So mental health well-being is really important for all of us. It's really, as a mental health professional, really important to me to ensure that everyone has a good understanding of what this means and why it's so important for us to find ways basically to nurture ourselves and be patient with ourselves and take care of ourselves, and especially in the midst of a pandemic. So this topic is clearly important for that reason. It's also important for, I just listed a few things here as examples. In the middle of a pandemic, it's important for a variety of reasons. One thing that, in doing some research and preparing for this presentation, that I found out was that Nova Scotia actually has the highest rates of COVID-19 related anxiety and depression in Canada. And that seemed really surprising, given that we have, the lowest rates of community activity of COVID-19. However, in reading the research, the thing that became clear to me is that in Nova Scotia, we have a lot of vulnerability in our population. And some examples of that is that we have the oldest per capita population in the country. We have 1 out of 3 people in Nova Scotia who identify as having some type of disability or difference, whether that be a physical, mental health, or learning challenge. And then 1/4 of our children, according to 2019 Stats Canada data, 1 in 4 of our children live in poverty. So when you consider those 3 factors alone, you can see that there is increased vulnerability in Nova Scotia, and that contributes to more feelings of vulnerability, I guess, increased vulnerability, so more feelings of vulnerability, but just feeling more likely that you may be impacted, or your community is going to be impacted, or your elder parent or grandparent is going to be impacted. So that's one reason why this topic is important to just talk about. The other thing is that we know with adolescents, there was a study done in 2020, just recently actually, that shows teenagers in particular have increased worries about school and their relationships with their friends, and increased mental health issues related to depression and feelings of loneliness. And that the relationship between anxiety, depression, and loneliness was correlated with increased use of screen time. And that's interesting to me because in the absence of face-to-face social interactions, one of the things we have been encouraging or have been more relaxed with during the past 8 or 9 months is allowing children to be on their devices and social media a bit more than usual. So it's something that we have to be mindful of and understand a bit better what that relationship is. The other important thing to me is that I think it's really, it's super important to have region-specific information around Nova Scotians' mental health, especially in relation to the first point, given that we have more vulnerable population. So I think it's really important to understand region-specific mental health issues so that we can develop whatever supports we need in our community to help, whether it's like elderly people, parents who are, struggling, adolescents, younger children, whoever it is in our population that have a unique set of needs in Nova Scotia. It's important to look at how everyone's impacted. So that was one of the big reasons why I collected some specific data from our clients in the past 7 or 8 months. And it was, again, really important to me to understand, aside from, having our sessions with our clients, to really get some more specific ideas on how they were feeling with respect to their children, their family, and their overall mental health well-being. So I'm going to go over some of that information with you. And so we collected information from 81 clients. And what I did was I just randomly took between March and October 2020 and picked every 3rd client or so in my schedule and sent them a questionnaire. And I created a 31-item questionnaire survey. And we got a response rate of 69%, which I was really pleased with. I thought that was really great, and I'm grateful for people, everyone who did fill out the questionnaires. It was really helpful. And the responses were collected between October 25th and November 2nd. And so the participants, of all the people who filled out the forms, 60% of the participants were moms, 17% were fathers, 22% were youth and young adults, and then 1% were children under the age of 12. And then of all of those age groups, for the children who were aged 13 to 18 years, 33% of those parents responded. 33% of the participants who responded had children between the ages of 5 and 12. 12% of the parents who responded had children greater than 18 years. And then the other 22% were youth and young adults, 16 and older, who didn't have children. So they were that group of people who answered the questions. So we had some really, a couple of positive things around mental health well-being. We had more than a couple, but I chose the two I chose were related in the next two slides. One of the questions we asked was, did you and your family spend more time outside in nature? We had 67% of our participants say yes, in fact, we did, and gave examples around, we've been going for long walks every day. There's a lot of biking, walking, hiking, camping, gardening, those kinds of things, and just a lot of hanging out and spending time doing things that typically were not done, like going for evening walks. As an adolescent, going for an evening walk with your parents and weekend drives. So some really good stuff. So almost 2/3 of the participants responded yes to that. The second question that was interesting to me was that, did you and your family feel more emotionally connected with one another? And 72% of the population said yes. And here are some examples of things they said. We asked people to give qualitative examples of things they did. And so, we spent more time together. Our work was impacted, which meant more time together during the day and evenings. We learned to find support in one another in a meaningful way. We have discovered shared activities and gained a better understanding of one another. We were all experiencing these changes to our lives together, and without question, we had to support each other. I really like this one. In the beginning, we had no choice but to talk to one another, be with each other as there was no one else. Then it became natural and easy, and we learned more about one another, stuff that we had forgotten or new things, and felt we had more time together with fewer activities to run around to. So again, more time out in nature, more time together, and really feeling more emotionally connected. And 72% of our folks said that. So that was really lovely to see. I'm going to talk a little bit now about the questions related specifically to anxiety. And so we asked, since March, have you experienced anxiety due to COVID-19? And 84% of our youth and young adults and parents responded yes to this, and 16% no. So what is really interesting in this is that the national statistics for mental health issues is 1 in 5 people experience anxiety. In our case, with our group of respondents, 4 in 5 people experienced anxiety. And then we asked them, to what degree, right? And so rate your anxiety as being slightly, moderately, or severely higher. And see that 45.6% people reported moderately higher and 31% said severely higher. So in my world, that is a lot of people. That's 76% of people reported more than usual anxiety levels. And when you think about yourself, perhaps where you might be in this, I think a lot of us, including myself, would say that the pandemic has certainly made us more aware of feelings of vulnerability, and just over time realizing, because there's so many things we can't control, that your anxiety is going to build up and show up in different ways. But I was surprised with the large number of moderately to severely higher elevations, which just again then reflects that we need to provide more support. So when has your anxiety been the highest versus the lowest? And these numbers aren't in percentages, but just more in terms of number of respondents. And so the highest amount of anxiety for people was in mid-March to May. And then the lowest amount of anxiety was in summer vacation. So that was not surprising, I don't think. It makes sense because around summer vacation is when the bubble opened, opening of the Atlantic bubble, and then summer vacation allowed just for more opportunities to see friends and travel and do road trips and all of the things that allowed people to connect with each other. Then we asked parents, since March, has your child's anxiety changed due to COVID-19? And 72.3% of parents said yes. And most of the anxiety seemed to occur similar to the families at the beginning of the pandemic, and then was lowest in summer vacation. So similar patterns to the parents. What was really interesting is that the anxiety levels of returning to school were not that far off than the beginning of the pandemic. And qualitatively, what, this from my conversations with children and families, children and parents, when school was starting, there was a lot of anxiety around what it was going to look like. So while many people were very excited about seeing their friends and seeing their teachers and going back, there was still a lot of ambivalence around what will it actually look like. Even for example, wearing of masks. Will I have to wear my mask all day? Will I be allowed to, take my mask off in the hallways, outside? And that was just one example. How far apart will I be sitting from my friends? So a lot of anxiety. So the 22 number, which isn't that far off from the 26, wasn't that surprising to me based on the stories I was hearing. Then in relation to mental health, well-being, and mood, we asked similar questions. And 78% of parents and young adults reported feeling changes in their mood as a result of the pandemic since March. And they rated their mood as being slightly, moderately, or severely lower than pre-pandemic. And what you see is that 54%, so again, a large percentage of people, from my perspective, reported moderately lower mood. And then slightly lower was 35%, and severely lower was 11%. So 65% of people reported what I would call significant changes in their mood post March. And the lowest period of feelings of mood, their lowest was at the beginning of pandemic, similar to anxiety. And then what's interesting is returning to school, children's returning to school, and at the present time, when you clump sort of, mid-September to October, which was around the time shortly thereafter where we collected the data, there's still a significant sort of feeling of malaise and low mood. And, I was trying to think of maybe, what is that about? And probably it is related to some uncertainty, but I also think that during this period of time, there are some, for example, Thanksgiving coming up. There are some celebrations and things people are thinking about that have a lot of uncertainty and require, not being able to see families and family members and friends. And so those sorts of things might also contribute to just feeling kind of a blah, not knowing when things are going to change. So not surprising to me that, the highest mood was at the opening of the Atlantic bubble and during summer vacation, when people could see, their family and friends and feel connected to one another. And then we asked a similar question of, has your child experienced changes in mood, feelings of loneliness and depression? And close to 70% children reported, the parents of children reported seeing a change in their child's mood. And 50% reported that their child's mood was moderately lower, and 15% said severely lower. And some of the behavioral indicators of low mood that parents reported were seeing, more agitation, irritability, a general sense of malaise, withdrawn behavior, just wanting to spend more time alone, kids being more impatient, easily frustrated. A lot of the sort of the physical things you can see when anyone is really feeling sad. And children's mood seemed to be the lowest at the beginning of the pandemic, But similar to the parents returning to school, and at the present time, there's still, still some activity going on there in terms of people seeing their children's mood not being the best. And similar to their parents, opening of the Atlantic bubble and during summer vacation was when kids were the happiest. We asked parents, have you or your child experienced feelings of self-harm? And what we found here was, that the majority of people did not. So that was, that was really good to see, quite a relief to see. However, there was still a significant amount in my mind, 23%, of parents reported that their child reported feelings of self-harm. And then, so those are, just a reminder, those are children under the age of 12. And then in the parent and youth young adult group, 15% reported that they experienced feelings of self-harm. And of that 15%, 61 were youth to young adults, and then 39% were parents. And again, I think that this data really speaks to how difficult this time can be, and shows like the range and variety of the impact, the pandemic, well, the collateral damage, and what Kathleen is going to talk about, the pandemic echo, what the impact of that is on people, and just the range of the impact on mental health. So some behavior changes that we noticed in children and parents and young adults that we didn't notice. We noticed, but also parents reported. These are just some examples. In children, parents reported, they saw their children not exercising as much, eating more unhealthy things, which we know, that under stress and anxiety, our body produces chemicals that body and brain produces chemicals that make us crave, carbohydrates and not, so the healthiest kind of foods. The other thing was increased screen time, and other associated behavior patterns were difficulty sleeping, being more withdrawn from family. Particularly the comments that were noted around that were for children who seemed to be more depressed and lonely and just generally, sad. And then more feelings of tiredness were noted in children by parents. And in parents and the youth and young adult group, they themselves reported, less exercise, increased unhealthy eating, similar to, what was reported with the children, more alcohol consumption, reduced sexual activity, also increased screen time. And then some other things that were noticed were difficulty concentrating, sleep disturbance, fatigue, less concern with appearance. And I would say some of these things I noticed because we were doing a lot of telehealth, and that I noticed changes, when I was seeing parents in how, they appeared to be more energetic and more sort of present. And as time passed on, in particular, end of April, May into the start of June, people were looking more fatigued. Parents were showing up with coffee cups. Sometimes parents were still in their robes. So we really saw that, over time, as people got tired, as people, just didn't know what was going to happen, there was a change in mood and a change in sort of their behavior, which showed up, on how they showed up on the screen. So I thought I would include some reflective comments. We asked people to provide some comments that would be helpful for us to share with you. And so one of the first ones is, what is your child's biggest worry about the pandemic? And so getting sick, not seeing friends, worry about grandparents getting sick, and also others not following the rules. What is your biggest concern about the pandemic on you and or your family members? So this is a direct quote. I'm unsure about the future. How will all of this change all of our lives? I'm scared for my grandparents getting sick. My sister couldn't get married, and I haven't seen my grandparents since last Christmas. I never realized life could be so different so quickly. I worry about a second wave and shutdown of things. Even though I'm close to my family and have a good group of close friends, I feel a low level of sadness and loss of energy. I feel like my life is not where it's supposed to be, and the pandemic has put a halt to many experiences I was hoping to have. I think the echo will go on for a while. How could it not? I think the pandemic has really hurt me socially and made me feel nervous about life. I think that I will have a hard time this year because of all the restrictions at school, having to wear a mask and making a lot of sacrifices. I don't mind making them, but I think they made me go through my first trauma ever. It will take some time to feel secure again. And I have to say that this comment is one that I hear a lot from, people who are in that sort of 15 to 19 age range, is that they really made a lot of sacrifices. Everyone has made a lot of sacrifices, but they really report how traumatic being away from their friends and their social life and just that lack of connection has been on them, and just how it's created an overall feeling of insecurity and vulnerability. So it's really going to take some time for people to build, whenever the COVID-19 is done, I guess. Hopefully it'll be soon. But I guess that's part of the issue, is we don't know when that's going to be. And so it'll take some time for people to feel secure and really have their anxiety levels go down. I'm really stressed about how the pandemic has changed things from my last year in high school. I cannot sit in class for 2.5 hours and pay attention. Who can? I'm not sure what genius thought that was a good idea. So I work all the time. I can't talk to my friends because we're all wearing masks. My teachers look exhausted, and I feel bad asking them for help. Coming back to school has not been fun, not like this. It has left me feeling vulnerable and feeling like I cannot get back the control I need to make my family safe, including my parents. It's a terrible feeling. So, what have we learned thus far? So far, we've learned that the psychological well-being of children and families has certainly been impacted by COVID-19. We've learned that the impact is real and pervasive. That means it's affected social, emotional, and behavioral well-being at all sorts of levels. Also learned that we are all vulnerable. But again, what I have also learned is that we can find some fortitude in the face of adversity, and we can be adaptable. So while we don't want to continue this for, any length of indefinite time, it is, good to know that we all have adapted and we've all kept and continue to keep our community safe, which takes a lot of strength, or fortitude. We've also learned connection, support, and open communication is absolutely necessary and vital for our ongoing mental health well-being. And so as much as you can connect with others, whether it's virtually, go for walks outside, talk to your parents, find ways, any way you can to connect and reach out for support, that is absolutely critical for the long-term well-being. And then my comment to all of you is to make sure that you practice kindness and patience with yourself, and with others, and that this is the most critical time, when there's so much uncertainty in our lives, that we do take the time to just be patient and feel what you feel, and then, be patient. So I'm going to turn this over to Kathleen, who is going to talk about the pandemic echo and provide you with some information that is helpful as you try to manage this COVID-19 for the time it goes on for. I thank you very much for listening to my part of this presentation. Thanks.
Hi there. My name is Kathleen Smith, and I'm a psychologist and a associate at Dr. Pier and Associates. And I'm just going to pick up where Dr. Pier left off and start talking more about the pandemic echo. So when we're talking about an echo, we're referring to something that's repeated or reverberates after the initial sound has stopped. And in the case of a traditional echo, we might be talking about a sound. So there's an initial sound, and that sound bounces back to us even after the original one has ended. In the context of the pandemic, the psychological impacts of what we're experiencing are likely to continue to reverberate and echo within our lives even after the initial crisis stage of the pandemic has ended. You might have heard discussion of this in the media, where there's talk of an echo pandemic of mental health issues to follow the COVID-19 pandemic. So essentially, the idea is that there's the physical health pandemic that is COVID-19, and then there's this possible after effect of a mental health pandemic due to restrictions imposed because of COVID-19. So we all have a decent idea of how this is impacting us and impacting our youth right now. But there's a lot of uncertainty about what's going to happen in the future and what the long-term effects of this pandemic will be. The way I think of an echo is that it can apply to grief of all kinds. So we experience loss and we have the grief associated with that. And then when we experience something similar again in the future, we might have that grief echo back to us of our original loss. Now, a unique aspect of the pandemic echo is that it's cyclical in nature with the pandemic itself. So we have waves of the COVID-19 pandemic. We have wave one, we have wave two, and those interact with the echoes. The way I think of this is if I were to yell into a cave, my echo would bounce back to me. And before that echo bounces back, I'd yell again. And before that echo bounces back, before that ends, I would yell again. So there's these overlapping echoes of the original wave of the pandemic and then the mental health effects. So one of the things that we have to consider is how do we deal with what's already happened? And we have to admit and validate to ourselves and to each other and to our kids that our lives and our understanding of the world have changed. For many, the experience of this pandemic has been or continues to be traumatic, even here in Nova Scotia, where the relative impact of the actual pandemic in terms of number of people being ill or hospitalized or dying is lower than most places in North America. It's important to acknowledge that this has been traumatic. This has been a serious change in how we view the world, and take the time to grieve that while we work towards a new normal, rather than just having this pressure on us of adjusting and moving forward and not stopping to acknowledge what we might have lost. And we have to consider all of that while also dealing with what might happen next. And that's a difficult challenge in the position we're in right now, where we're dealing with the last 8 to 10 months, and our brains are also trying to cope with the uncertainty of what's coming next. So during our, as part of our survey, we asked people about how they're feeling about a second wave, how worried they are. And when I look at these numbers, I see that almost everybody is worried, right? Some people, especially some kids, are maybe only slightly worried, but the vast majority are, if we look at the sample as a whole, moderately or severely worried. And this data was from November, October, November. So since then, we have dealt with numbers rising again. So this is sort of before that happened, how worried were we that that was going to happen? And with chronic uncertainty, we also asked about that. So like I mentioned a few slides ago, there is this uncertainty of what is going to happen. And how do we deal with that? How do we work in that lack of concrete view into the future when we're dealing with what's going on? So we asked participants, the echo of the pandemic on mental health can vary on individuals and families. Do you believe the impact will be permanent, temporary, or unknown? So 46% of people felt the impact would be permanent, but 34% felt that it would be unknown. They didn't know, they weren't sure. And that uncertainty is really difficult. I think if we know what's coming, we can prepare for it, we can feel solid that we have a plan, that we can cope. When we don't know what's coming, that's a lot more taxing on us. So, how do we deal with that? How do we deal with that uncertainty? One of the big things I want to touch on is productive versus unproductive worry. So, productive worry would be thinking about things that we can control and thinking about things in the not too distant future. So, I can control that follow public health guidelines, that I practice hand hygiene and social distancing. I can't control the choices that others make, the overall virus spread, or the trajectory 2 or 3 years into the future. So, focusing on those worries on things that actually can impact my own behavior, can give me that sense of control, versus on the bigger picture things that are outside of my control is more productive. Another thing that I've talked to a lot of my clients about is the difference between being careful and being scared. If I'm careful and I follow public health guidelines and I'm cautious in my approach right now, then I don't need to be scared, right? So we don't we don't have to have that fear worked into our motivation to follow those rules and to have productive worry. We can be careful, and then we don't need to have that high level of fear. And in terms of the uncertainty piece, really validating for yourself and for your kids that uncertainty is hard. And especially if we're anxious, especially if maybe we're somebody that tends to be anxious in general. We want the world to be predictable. We want to know what's going to happen. And that's okay. Like that's part of who most of us are, that we want to have that sense of being able to predict something, something being consistent, being knowable. And that's not the case right now compared to how it often is in our lives. So, yeah, validate that that's hard for you. It's hard for your kid. Um, and then shift the focus to what we do know, what hasn't and likely won't change. So, there's lots of aspects of our lives that look different, but there's also lots of aspects that are the same as they always have been or have been for a long, long time. And those parts are often relationships. So, if you're talking to your child about this, like your relationship with your child is still there, it hasn't changed. Your child's relationship with important people in their life is still there and hasn't changed. And that might look different. Maybe they're communicating and connecting with those people in a different way than they have before, but the relationship is still there. And so focusing on those parts, that what can we know, can we predict for sure, and what isn't going to change, rather than always focusing on um, what we don't know and what we can't control. So, how can we support mental well being in a pandemic? And this is important right now as restrictions are a little tighter again in recent weeks, and Christmas is coming up, and things are going to look different this year than maybe they ever have for a lot of families. So, I want to talk about a few different things that we can do to support mental well being. One is finding meaning. So, if we feel that there's a lot of meaning in our life, and we derive a lot of meaning from our day to day activities, this creates a buffer for anxiety. So, to help your child, to help yourself engage with this idea, consider your own or your child's values. So, what is most important to them? Common answers when I do this work with kids are their family and their friends, but it could be other values as well. Could be free time, could be adventure. There's lots of different things that might come up. And then brainstorm how they or how you can live out these values even during a pandemic. So, again, like I spoke about on the previous slide, it might look different. How you're approaching those values might look different, but that doesn't mean we can't approach them. How we find meaning in our life might look different, but that doesn't mean that our life is meaningless. So really digging in and figuring out how can we find meaning and life satisfaction day to day, even in this time, that's going to create that buffer for some of that more negative thinking that comes in. Exercise is also really important. And I'm sure that's not a new idea to anybody, but there's now new research about exercise during quarantine, specifically in different countries, where more physical activity during quarantine is related to less loneliness and then less severe post quarantine depressive symptoms. So these are for areas where they've been through lockdown and they haven't been able to do anything or see anyone. So people that engaged in more and higher intensity physical activity during those times had better outcomes, less lonely, less depressed. And there's some interesting reasons that have come out as to why that might be, other than the typical, what we know already, that exercise, especially high intensity exercise, really promotes good mental health, even outside of a pandemic context. In this context, it gave and this was true in teenagers as well. So let's use that as an example. It gave teenagers a sense of control over their own body and their own life that they weren't getting otherwise during lockdown. And it also gave them a sense of feeling strong and confident in their body. So the more that they worked out and got exercise, the more that they felt that they could be confident in their own body's ability to fight off infection. And then that made them less anxious as well about getting sick. So lots of good effects there with exercise. Maintaining a daily routine is also really important. So a lot of the external structure to our life might not be there when restrictions are really tight. So if schools are closed, if work is not happening as normal, those parts of our life that are structured for us, like we have to get up at 7:30 to get to school for 8:30, and we have lunch at 11:30, and we have basketball at 7 p.m. So all those things might not be there. So it means we have to create our own structure a little bit and our own routine. And even if that routine is super simple and it's just, daily activities that are taking care of ourselves, but we engage in that regularly, that's going to provide a buffer for the chaos or the, again, uncertainty, or just the all the things that are different than they would normally be. It's going to create more predictability and more feelings of control. And when we take care of ourselves, we're also less likely to feel depressed. The last one I have here is limiting screen time and news consumption. So uh, this might be different for adults and kids. For a lot of adults, there's been a lot of news that we've seen, and the news has been, often very dire, as it sometimes is, but especially during this pandemic, it's been very dire. And so, setting limits on that and not engaging with that to a point where it's detrimental to our mental health is really important. So, as an example, maybe checking the news once per day. Or for kids, a lot of kids are getting a lot of screen time during the pandemic, which makes sense because a lot of their normal activities aren't happening. But limiting that and using it maybe primarily for high value social activities like FaceTiming with friends or family versus, hours upon hours of social media use or video game use. And there is some research that's showing that a lot of social media use for teens during the pandemic is actually contributing to more depressed feelings. So just keeping that in mind when you're setting limits and you're choosing what that screen time is going to be, trying to link it back to what your own or your child's values are, and using it to promote those feelings of having a meaningful life. A lot of the focus when we talk about child mental health during the pandemic is on the child, which is great, and we need to talk about that. But we also need to talk about support for caregivers. There's a lot of caregiver burnout that is happening during the pandemic. Um, Adults have really sometimes impossible roles, it seems, during this time where maybe, especially when schools were closed, maybe you're home and working full time, and your kids are home, and you're trying to provide schooling to them and provide entertainment to them while working full time. And maybe you have elderly parents that you're worried about. Like, there's a lot of stressors. So keep in mind, and this sounds basic, but it's easy to forget, keep in mind that taking care of yourself will allow you to continue to take care of your child. It's not selfish to take care of yourself. Keep it simple. So set reasonable goals for your day, for yourself, and keep in mind the present circumstances and what Dr. Pierre talked about the mental fatigue that's happening when our amygdala is activated all the time and we're worried all the time. So keep that in mind and keep things simple for yourself. There's a lot of things online of people doing these projects and learning a new skill and all these sort of big things that they've gotten done or they've seemed really productive during a pandemic. But if you're just getting through the day and you're taking care of yourself and you're taking care of your child, that's a success. You don't need to do more than that. Breaks are great, even if they have to be short, but take a genuine break from work and from caregiving responsibilities so that you can recharge. You can fill up your own bucket. You can put on your oxygen mask before you put on anyone else's, as they talk about in the planes that we used to go on. So just do that. Like take a break and be there for yourself so that you can continue being there for your child. And hopefully, there's the ability to reach out to your own support system as well when you need to, and to engage that because a lot of us are feeling similar feelings, and we can really support each other and empathize through this. And then, in terms of what you can give your child, lots of quality time or time in with children is really great during this time. Um, you know, I think there's the tendency sometimes to just exist in the house together, which is okay. It's still time around each other, but trying to spend that really intentional time with your kids is really great, even if it's 20 minutes a day of time where maybe they get to choose the activity and nobody's on screens and it's just really focused time between the two of you. The other way to do this is just in passing. Lots of pats on the back or good jobs or I love you or I love spending time with you, praise based comments like that that build that child up and remind them that you are there with them. It is really important to validate your child's experience with the pandemic. I think I've said that a few times, so that's probably clear. But um, kids are super resilient and they are adjusting and they are doing the things. But that doesn't mean they're not experiencing feelings about all of the changes that they've gone through. So validate that, make space to talk about that, and just normalize that conversation being ongoing. It's helpful to reassure kids about their safety and the safety of their loved ones and provide age appropriate information. So information is helpful, right? I think when we keep everything a secret, that actually makes it more scary for a lot of kids. But just provide that information in an age appropriate way and empower them to know why they're doing the things they're doing, why they're being asked to wear masks and to stay away from their friends, while reminding them that doing those things keeps them safe. So, again, that idea of if we're careful, we don't need to be scared. And then there can be a shift to positive stories to balance the negative. There's a lot, like I said, there's a lot of information that we as adults and our kids are getting that's maybe scary information or it's sad information. So try to expose kids and adults to stories that are more positive, maybe stories about neighbors helping each other out or some kind act that somebody's done or an elderly person having an amazing recovery, whatever it might be, um, shifting some of the focus to that positive and that resiliency based information. Now, in this idea of support for your child, um, sometimes the feedback we might get the feedback we might get might be, what if my kid doesn't want to hang out with me? What if they don't want to talk about it? What if my teenager just stays in their room and doesn't want to have the conversation, doesn't seem to want to connect? So it doesn't have to be a huge event to hang out. You can meet them where they're at. You can open their door and Just say, I love you. You can sit on their bed and ask them how their day was. So you can reach out to them, you can meet them where they're at. They might give you pushback, but you can still provide that safe landing place for them. How do we buffer our coping skills in preparation for, this road that we're still on? We're not through the pandemic season of our lives yet. So how do we buffer those coping skills? And I'm just going to get you to think about some of these things. So think about what your current coping skills are now. How do you cope in periods of stress? And what about when that stress is prolonged, as it is in the pandemic? Are there any really awesome coping skills that you have that you rely on? Are there any coping skills that are maybe well intentioned, but they're actually not taking you down the path that you want? Um, so, some of the feedback we got on our surveys was around maybe people not exercising or people drinking more, or different coping skills that, maybe are helping us in that moment, but in the long run are leading to more stress or more isolation. So, thinking about that and thinking about just checking in with your coping skills. Are they serving you? Are they as helpful as you need them to be? This is a difficult question, but what would help you cope better? If there are areas in that first question that came up of, yeah, okay, maybe some of my coping skills aren't helping as much as I want them to, then what would help you cope better? Do you need more support? Do you need more breaks? Do you need, what is it that you need? And having that conversation with your support system, um, so that there can be openness around that. And sometimes we do need more help. So if you or your child, the worry and sadness that you're experiencing is more persistent, or interferes with daily life, or is resulting in really a change that you can notice, sometimes seeking professional help, seeking psychological services or therapy, um, is that extra support, that extra layer of help that you might need or your child might need. And that's okay if that's the case. So there's a lot that we can talk about in terms of, okay, this is happening now and it's probably going to impact our kids. We're not exactly sure how it's going to impact our kids, but it probably is. And that can be a scary idea. But I don't want to leave you thinking that this is all doom and gloom, or there's no hope or no resiliency. We know that children are resilient. We see it every day. I see kids every day where they go to school and they wear masks for 6+ hours, and they really don't complain about it. It's amazing. They do the hard things. They find them hard sometimes, but they do them. They are doing them. And that's true for all of us. We are finding this hard and we're doing it. So that recognizing that resiliency in your child and in yourself, I think, is important in mitigating some of the worry about the future. And with what we've talked about today, I hope that you can take away the idea that there is a sense of normalcy and security that can be fostered for kids with the right ingredients in any context. And we know this based on research in a wide range of contexts, even war zones, right? Even in really, really such difficult situations, we can foster a sense of normalcy and a sense of security between a parent and a child with the right ingredients. And some of those ingredients that we talked about today would be that like strong connection with the parent, that structure and routine that's maintained, even if we have to provide it for ourselves instead of it being provided externally. Physical exercise, social connection might look different, but we still need that social connection, and finding meaning in our day to day. So, focusing on that, not making it too complicated, but focusing on those key ingredients as we continue to walk through this path, and are asked to continue just to do our best by public health, and we are. So we are resilient, we are doing it, and our kids are too. Um, And this is a recorded version, so there is no Q&A, but that is our presentation. And I hope that that provided some food for thought and that everyone watching this has a great day. Thank you.